Medicare for All is one of the most talked about topics on the Democratic campaign trail. While enticing to some, the concept is roundly rejected by some centrist Democrats.
Another big part of the discussion for Dems is abortion rights. As more states pass heartbeat and other legislation bills aimed at curtailing access to abortion, Americans are weighing in. According to a new USA Today Ipsos poll, 55% of Americans oppose the fetal heartbeat laws passed in 5 states. When asked about closing all abortion facilities in their states, 73% oppose the action. As it strengthens Republican resolve, these issues also seem to be energizing Democrats heading into 2020. Joining us to discuss the abortion measures being taken up nationwide is Washington Congresswoman Dr. Kim Schrier. She's one of the 40 freshman House Democrats who flipped GOP-held seats in 2018. She's also the only female doctor in Congress. Congresswoman, thank you for being here on Rising.
Thank you, Jamal and Buck. I'm happy to be here.
So I guess as we get started, let me just ask, what's your biggest concern with the bills that are being passed right now?
Well, my biggest concern is that this is just more attempts to chip away at a woman's right to choose and make her own health care decisions. You know, it's interesting, I was listening to your lead-in, and it is true that 73% of the American public is pro-choice. And I find it really interesting that 55% oppose these heartbeat bills. I have a feeling that number would be much higher if people understood what it really meant, because I can tell you, and I know I'm jumping into the science a little bit, but that I can tell you about a single heart cell, a myocardial cell in a petri dish in a lab at the University of Washington that will beat. All this is evidence of electrical activity, which happens in a myocardial cell. And so I think what the right has managed to do is somehow conflate a heartbeat with a soul or with personhood. And I believe that if people understood that this is just what a myocardial cell does, that number, 55%, would probably go up to 73%, that anybody who is pro-choice would understand that that is just a gimmick.
Congresswoman, when do you confer personhood, as you put it, to a fetus?
Sorry, can you repeat that question?
When would you confer personhood, the term you use, to a fetus?
Sure. Well, you know, I think that is a very philosophical, personal, and religious decision, which is why Congress should not be making that decision. I know for some people, for their religion, it means that it starts as soon as a sperm hits an egg, and for others, it doesn't happen until viability or even birth. And so I think that this is just a decision that, because it is not in the realm of medicine and not in the realm of law, Congress needs to be out of that decision.
Well, it's obviously very much in the realm of law now. And you mentioned polls before, and you mentioned support or opposition to heartbeat bills. Overwhelming majorities of the American people in every poll that's ever been taken at a national level for the last 20 years shows that third trimester abortion is very unpopular. So if the polls should matter for the heartbeat bill, shouldn't the polls matter for third trimester abortion?
Well, I think that's another really interesting question. And again, the right has made a lot of effort to make this conversation about later in pregnancy abortions. And what I'd love for your viewers to understand is that less than 1% of abortions happen after 20 weeks. I think you should also understand that these happen in extreme circumstances. Like, women just don't decide after 20 weeks that they just don't want to be pregnant. That is just a fallacy. These are always situations that involve some dire medical situation that it either threatens the life or the health of the mother, or the life or the viability of the fetus. And these are fraught decisions that are heartbreaking. And again, this has to be between a woman and her doctor and her family. And there's no role for Congress to come in here and tell a woman what she should do if there is a devastating anomaly with her fetus.
Congressman, you're a doctor. What is the medical condition that would insist on there being an abortion versus bringing a baby or bringing a baby out of the womb in the third trimester? Is there a medical condition that you would need to do that? The termination of the pregnancy instead of induced labor?
So you're asking a question that, again, is not for me to make. I can tell you that I could make that decision for myself, but I would leave that for a woman to make that decision. So for example, because you're looking for a specific, if a woman found out that she was carrying a fetus with trisomy 13, which is guaranteed death sentence, those babies don't live past 2 years of age, if that. Or if she found out that she was carrying a fetus with anencephaly, where there is no brain. I think those are situations where the vast majority of people would say, why would you torture the woman and the fetus by going all the way through a pregnancy for what is a lethal condition? And so, again, this is not for Congress to decide. It's not for me to decide. It is for a woman to look at the circumstances and consider her health and the health of that fetus and make her best moral, ethical decision. And we should not be in her way.
So as doctors, as a doctor yourself, and obviously this is a situation where doctors are the ones who are involved here, you also have been focused on Medicare for All and making sure that people have access to the health care they need, both for prenatal services as well as for the rest of their lives. Tell us how you are focused on Medicare for All in your work up there on the Hill.
Well, first, I just would like to clarify that I am absolutely laser focused on universal access, on making sure that we all understand that health care is a human right and that no family should be going bankrupt because of medical expenses. I happen to not be in the camp of supporting a Medicare for All type plan because I don't think that we need to blow up and deconstruct our entire medical system in order to serve our population well. And I can tell you that in my district, people are really happy with the Affordable Care Act. Like, it took 5 years to roll it out, and probably another 5 years for people to really decide that they loved it, mostly because they tried to take it away. And so at this point, shoring up what we have, making it more affordable, making sure we bring premiums down and we take on the cost of prescription drugs, I believe that's how we go about getting universal access that is affordable and accessible.
How do you bring premiums down, doctor as well as Congresswoman? How would you bring premiums down?
Can you repeat that question one more time?
How would you bring premiums down?
Oh, so there are a lot of ways to bring premiums down. I mean, one of them is to bring back the subsidies and the reassurance, all of the things that were already stabilizing prices in the Affordable Care Act before this administration started undermining it. The other is to be able to negotiate drug prices and to have transparency in how our medications are priced, and also so doctors know which medications cost what. The other is that we are now considering legislation that would cap any one family's premiums at no more than 8.5% of their annual income. So in my district, for a family of four at the 400% of poverty level, earning just over $100,000 a year, their premiums would go from $17,000 a year down to $8,500. And that is a meaningful difference that really makes a difference between affordability and non-affordability. And so those are some of the ways, and we will be introducing that legislation coming up soon.
So, Congressman, you're against Medicare for All, but are you for or against any sort of a public option that would allow people who are being left out or live in one of these states where maybe there's only one health care insurance company and there's no competition because there's only one left in the Obama marketplace? Would you be for a public option for people to be able to get into, even if it wasn't a mandatory option like Medicare for All?
I am enthusiastically supportive of a public option. In fact, I have co-sponsored a state public options bill that would give people exactly in those circumstances that you're talking about, where there's no or just one insurance provider, the opportunity to buy into Medicaid, which fundamentally is a better system than Medicare, by the way, so that they would have an affordable option. I think that is a phenomenal option, and frankly, it's a way to, I talk about extending Medicare or Medicaid to all without overhauling the system and mandating that.
All right, Congressman, thank you for joining us. We appreciate your time.
Thank you for being here.
Thank you for your time. Have a wonderful day.
You too.
Thanks.
And good luck in that baseball game, softball game. Coming up on Rising,
Thank you.
The president continues his European trip with a royal state dinner. We'll discuss the status of our special relationship with Great Britain.
And 30 years after the Tiananmen Square uprising, how are U.S.-China relations? And the president's war with CNN, the latest casualty is AT&T. T. Brising's going to weigh in on that coming up.